Okay, so let's go to the second part. Let's talk about diseases and conditions of the ear. Now, the common signs and symptoms of the ear are otalgia, which is pain in the ear, deafness, vertigo, or tinnitus. So vertigo is dizziness and tinnitus, ringing in the ears. Conductive hearing loss. This occurs when sound waves do not reach the inner ear. Sound is not conducted efficiently through the outer ear canal to the eardrum and ossicles of the middle ear. Causes are impacted cerumen, infective otitis externa, swimmer's ear, otitis media, and otosclerosis, and we're going to talk about each one of these. Impacted cerumen is an excessive accumulation of earwax in the outer ear canal. Okay, see that earwax? Infected otitis externa is an infection of the external ear canal. Swimmer's ear is an inflammation of the outer ear canal resulting from trapped water during swimming. Otitis media is accumulation of the fluid behind the tympanic membrane. It is an inflammation of the middle ear. So one of the treatments is a tympanoplasty. This is when pediatric ear tubes are inserted to facilitate drainage and prevent hearing loss. Otosclerosis is an abnormal growth of bone in the middle ear. This bone prevents structures within the ear from working properly and causes hearing loss. Affects the stapes bone. A normal stapes bone moves like a small piston. Sound causes piston to vibrate. In otosclerosis, a callus of bone accumulates on the stapes, creating a partial fixation. This limits the movement of the stapes bone, which results in hearing loss. Meniere's disease. The vestibular apparatus is concerned with detecting position and movement of the head. It consists of saccule, utricle, and 3 semilunar ducts. Make up the membranous labyrinth. The membranous walls are separated from the lining of the bony labyrinth by perilymph, a fluid similar to cerebral spinal fluid. The fluid inside the membranous labyrinth is endolymph, a liquid similar to intracellular fluid with a high concentration of potassium and a low concentration of sodium. The current theory is that it is caused by an imbalance in the fluid pressure between different compartments of the inner ear. The endolymphic compartment is believed to build up excess pressure and cause swelling. Because the inner ear is entirely encased in bone, there is no place for the swelling to go. This results in damage to the small hair cells in the middle ear. This can also result in tears in the membranes. Fluids are then chemically mixed together, short-circuiting the middle ear. Each time these abnormalities occur, a patient experiences severe symptoms of an attack. Once the pressure has been released, the membrane begins to heal and the fluid chemistry returns to normal. The symptoms are relieved. So the bony labyrinth is filled with perilymph, and the membranous labyrinth lies within the bony labyrinth, and that has the endolymph. Benign paroxysmal positional vertigo. This is characterized by sudden, brief episodes of mild to intense dizziness associated with specific changes in head positioning. It most commonly occurs when you move your head in a certain direction, lie down from an upright position, turn over in bed, or sit up in the morning. So the symptoms are precipitated by head movement. Okay, so in the posterior semicircular canal right here, you have the otoconia, and they move here during head movement in BPPV. Okay, and they're not supposed to be there. And these otoconia are small calcium carbonate crystals, and they're normally present in the utricle. Okay, so what happens, they get displaced and they get into this semicircular canal. Labyrinthitis is an inflammation or infection of the labyrinth, which is the middle ear, Ruptured tympanic membrane is a tear or injury to the eardrum. Cholesteatoma is a sac or cyst created that fills with old skin cells. Can be congenital, but more commonly occurs as a complication of chronic ear infections. Poor function in the eustachian tube leads to negative pressure in the middle ear. This pulls part of the tympanic membrane the wrong way towards the ossicles, creating a sac or cyst that fills with old skin. With old skill cells and other waste material. The cyst becomes infected. The cyst may enlarge and break down some of the middle ear bones, affecting hearing. Mastoiditis is an infection of the mastoid bone. It's usually secondary to inner ear infection, and it's commonly caused by Streptococcus. Sensorineural hearing loss. This occurs when sound waves are not processed correctly. Occurs when there's a damage to the cochlea, which is in the inner ear, or the nerve pathways from the inner ear to the brain, and that's retrocochlear. Causes permanent hearing loss. Some causes could be injury during birth, ototoxic drugs, which means it's toxic to the ear, noise exposure, viruses, head trauma, aging, or tumors. And that's it for this chapter.